show you remove. They try different. They ever sound like I three. Check HIV. Check sickle. Not them you. Hepatitis B. Hepatitis B. Not them you. Blood group. Not them you. Lab investigation. Both. If you have a class square labs, and first we must know what to check before we can say the importance of why we check it. And yaka protein, yaka sugar, yaka HIV, yaka sickle, yaka hepatitis B, and then you HB, a blood group, and the G6BD, J for goats, 6 for 6, P for who? Pot or Peter Bebo, and D for who? Daniel. Daniel. Okay, so J for goats, and the kind of J for God. J for God. Aha. So J6PD, and then you Almighty. Almighty of all the labs is what? Almighty of all the come and you be a 5 cities. Ya Canada, and you're Almighty. And also you're Almighty. Second, you're Almighty. And also you're Almighty. HB, clap for her. Almighty, people are jumping. Well, jumping, but I'm a kind. Oh, my dear fast. But we have been put the paper. I teach our person chapters of this guy also. HB is the head of all the labs. Your HB. Now you can have retro or HIV positive, and you can carry a healthy pregnancy, a safe pregnancy, and you'll be okay. You can have syphilis and carry a safe pregnancy, and you'll be okay. But when your HB is low, when your HB keeps on going down, you will never be happy throughout your 9 months of pregnancy. So HB is the head of all the labs. So you realize that in your book, page 6. You have 1, 2, 3, 4, 5, 6. 6 times an HB is checked before baby is born. Because that is the head. Aside protein, any sugar, every month you're checking. This HB, and then the master of all. Because a good HB guarantees a happy pregnancy. Not just a happy pregnancy, but a healthy pregnancy. Good HB. Why? Why do you think it's like that? I think some people say HB and then the head. Maka, this will be someone said, why do you think it's like that? Yes, please.
I think during the birth process, the woman loses blood. So if the woman doesn't have enough blood, the woman can die from the.
I don't want to change. I know your secondary matter. I know the children cry. I know your DNA cry. I put your throat down and whatever. Yes.
Because it's the blood that is forming the baby.
It is the blood that is forming the baby. Baby is dependent on you, your mother, your blood, for nutrients, for strength, for development. Now, when it comes to pregnancy, it is like the military zone. Do before complain. When it comes to pregnancy, it is like the military zone. So what happens in the military zone? If they say kill your mother, you ask why you should kill your mother. You will finish killing your mother. Before you go and ask your commander, why did you say I should kill my mother? Then the commander will say, because your mother is beautiful than my mother. Then what happens? Mother is very dead. So can you bring her back? No. So when it comes to pregnancy, HB is like that. Now the child in utero, if the child needs 5.2 pints of blood every month, the child will take the 5.2 from you, the mother. It doesn't care if your HB is less than 11 or it's less than 10. Once or not, or friend or your phone, you have 2.5 from, and I said 4.5, or by 4.5. They are actually infallible. If you remember when the midwife was delivering, she said when it happens that you fall, the likelihood cover the baby, cushions the baby, so they don't get affected, depending on how you fall. The same way, if they need the 11 or the 4, they will take the 4. They don't care what you are left with. If what you are left with will make you feel dizzy and you fall down, they don't care. They have to survive. Survival of the fittest. So naturally, the body will take what the child needs to survive. Now, it's only after when the child has taken and you are not getting enough, then the baby will consider you by giving you some of it. But I don't promise you, why you okay answer. In case where you are pregnant with two fetus, twins pregnancy, Penny will say, oh, let's give mommy some. Kakra will say, no, I am not okay. So before they think of giving you, already you are already been admitted for dizziness, for collapse. Then Kakra will say, but I told you she'll be okay. You see that she has been given infusion, now she's okay. Then they finally take it. So HB in pregnancy is the bedrock of a healthy pregnancy. So for a midwife to have a sound mind that this my client is having a good pregnancy life. Let me know your first HB as coming to me as a pregnant woman for the first time. So HB as registration, they will check. Okay, let me see that the medication that I gave you that you went through the first 4 weeks, is it working? So there is a repeated HB after registration. Now, when they realize that, okay, the one you came in with, when I gave you the medication, it has also increased, or it is stabilized, then let's say we can manage what we have for at least about 3 months. So you don't do HB again till you get to 28 weeks, which is a crucial moment. Because by 28 weeks, I expect the baby's limbs to fall. I expect the legs and everything and every organ to fall, which is waiting for only size to increase. Everything has fallen. So let me check at 28 weeks, does my client has enough HB? Because from 28 weeks, there is vigorous activity of the fetus. So at 28 weeks, is my client having enough HB to endure the activity that the baby will go through? If it's less, we will write in red. So if you take your book, and in page 6, you see any red mark, it is a cause for alarm. In page 6 and 7, if you should see any red mark in these 2 pages, which somebody, I said I will not say it. It is a cause for alarm. You remember that when the midwife sees that, they keep on humbling. And if you are for NHIs, for them to be of mind, because I know some of them are supported from the babies, not the mother, it's not you, the babies. Then they push you to the doctor, go to the doctor. But doctor, then are the only way yet. The doctor has nothing to do. They only give you medication, or medication to make sure that your HB levels up. Because when everything should happen, and you still have the red mark, that is when the last one the woman said, what did she say? The last one that she said. She said something, I said that is the secondary matter. What did she say? What's it? You are prone to bleeding. That is the last thing. Now, any woman with low HB bleeds a lot. Because said, Ade, yes. If you have low HB after the placenta delivery, you bleed a lot. But if you have a high HB after placenta delivery, you don't bleed a lot. Until you have my life. Do you know why? Because when we say you have low HB, it doesn't mean the water in your body is low. For the water in your body, your water level is the same. But the quantity of nutrients or micronutrients in your blood, which makes it rich, impurities in the water, rich, and it makes it easy to flow. Say impurities in the water, and not easy say, flow. There is no katawato. There is no kawana wash. Those kawatauts don't want to be swati. And he will bleed, and answer will bleed. And one of the things that helps in blood to cease is clotting factor. Now, if it has become too much, then it's bad. So you see, in pregnancy, all these things must take into account. Now, something especially if it's your first pregnancy. We need to know that of your husband as well. Let's say you are positive and your husband is also positive. What happens? As midwife, what happens? When man is positive, wife is positive, what happens? But if man is positive, a woman is negative, what happens? Man is positive, woman is negative, what happens? Why? I'm asking for you. Now the reason is that after baby is out, after delivery, we have something called cord blood. And deposit of the man's blood is left in the woman. So if it's positive and I am negative, your positive will be left in my blood, fighting anything that comes again, as if they are enemies. So it makes it difficult for another pregnancy. So to be on the safer side, after placenta is out, the woman is injected with anti-D to get rid of any excess of the man's blood from me that was carried by the baby from me, so that I have my own positive or my own negative, without the man's positive or negative with me, to allow next pregnancy. Next time, space for a bar. I bet you have the front. I pass a whole baby. Then you will be one fertilizer. Now what's that? But say you finish it. I pass a crap. You all know. And who for no about it? Until all man the pan can your egg fertilizer. And I'm man the brain. I am one. And I'm a brain now, so we are washing back. Why are washing them you? SS war. And the man will be national every day. So blood groups is very important. Now, after hepatitis B, and also when you are say if mommy is positive, I was saying when you were being pronafa. Now, pronafa. Say the baby or what? If a mom or friend or baby as the woman. Not on the same way, and we have hepatitis B. And you will be to say, hemoglobin. Hemoglobin, and my within the first 24 hours, I'm going to be asking. Now, say, Bruno, say, hemoglobin on the body. And you will say, we are positive. Now, if the Asia was delivered, say, but I don't know what you have to do at all. I can't remember, we are saying, because, yes, within the first time, but I saw me to a before. That is the policy. Say within the first system, or say into a before. Now, some also more anti-D now. How to be no more than one. Say the sharp and no. And say the on the safer side. You get to know your status. They start preparing towards anti-D. Sorry, hemoglobin. Now the same thing with syphilis. Abrana, Papa, midwife, Africa, so can say, and mother baby or what? You have problem or say, a child, you have Bessie Becca. Titino, not a woman today, and I shall check. So, what do we lose by a bombecker? A shall check. Sent is a check for me 2 days, 1 a day. I had a first double shot, we have said double check. First 1 day a day. I had some commission, put you some check. What did that? Hey, and I said, Saco. Yes, I should swap one. First election, I should swap one. A train of one. And so swap one, I yourself. Who go fear more because at least the witch will just show you who to be who. And the shop for hair, pubic hair. Second, the shop for discharge. Say, and so be if we say back. If you are not a castle time and so yet. Say, this are the bar. How does it look like? And it's emotional to move, say, this I need to go back. Then you go for a test. Say, this is never say infectious. And my choose you. And it's up for your lap, you say, oh, I will not banana flora now. Or song. Now, be a name of banana flora. Not the idea, then we treat it before labor setting. Because that place is called birth canal. I won't. And it's a yes in a war year. That's a who by SBD. Spontaneous vaginal delivery. Now, say a trainer who na pamede, ebefi mu beba. Say if there is an infection there, akola ne ba ne ni befa. Edu ntina, e ma mo mo so mo listen so ade wo paraphilical eye drop e wo so. Say be be ku kala de so na infection bi wo ha paraphilical end to be infection no. Infection bo do ya brewa. Infection bi enya wo brewa. Well, tell one now, don't mess up. What seems to be nutritious. What seems to be nutritious. So it's end up feeding the viruses or the infection, making them grow faster and beautiful. And the infection will have paraphilical eye drop into middle. So early prevention completes it. Early detection saves life. Early detection saves life. Early detection saves life. You wouldn't tell one that's anointed. Baby, now, which is specific in your life. We want to 5 years, and then express your share. 7 days, you have to mention the thickness. Every infection. Most of them are from infection. So when we realize that after vaginal inspection, most of we are now, you have to treat it before delivery. But then in the ENT, that was a section, that was an examination after because Mother said, I shall be checked. No, I don't think it's a giant. And I was just most of my country, I don't want to finish my country. Then I will do my treaty. And I put it on any scientific. Members for her. And tell them on country. Like I said, oh, hey, yeah, or you know, I'm paying on you want to because infection I matured when that nutrients aid into a flourishing with actually. And see a bomb. Who also do prove our fortune? Yes, I will prove our fortune. I want to bomb and all. Brave boy. That is just do you get it? So you say it, we treat it. And this is my yes, syphilis, and those labs. So you will not agent. The share some money the other, it's free. Do you get it? And happy. Yes, malaria test. Now, research my as said. Malaria test, you know, sometimes you don't get to see it any. You don't, when you do the first response, you don't get to see it. The malaria is in the liver. Now, malaria is the only parasite. Thierry analyze. Syphilis does not travel to the womb. Syphilis does not cross placenta. Gonorrhea does not cross placenta. It is only malaria that crosses the placenta. HIV does not cross placenta. And it's if mother HIV positive, it stays in the placenta around the womb, goes merry-go-round of the pregnancy, but can never get to the baby. It is only stubborn mosquito, that small boy without shoes, is the only parasite that can travel from mother through the placenta to the baby. They have a way of disguising themselves. So the body will end up thinking it is protein for the baby. And they give passage for it to travel to the baby. That is why now we say, even if your lab says no MPC as a pregnant woman, you will take malaria tablet. Whether we see it or we don't see it, you will take it 4 times before delivery. And 5, say do 5 for me, you are graduating. According to some malaria because it can cause low birth weight. Now sometimes when you are fortunate, nasa or cross a placenta look over a chenya. All for your father. What's it hot? No, so according to the baby. According to protein, also the protein. Only also the carbohydrates. So our carbohydrates 4 by year, or what you think? I'm not on the one. And so I'm not on ten. No, so I put that with the one of 4 years. So I said the birth weight is about 1.5, 2.2. No birth weight. But then, or so we are. I told you that I'm not on the baby side. No, someone neonatal jaundice because one gene nutrient to the brain so the child will end up with neonatal jaundice. I want it fresh. What's I jaundice? What I like to say. Now, after a battle between God and man. God will do the I want that toss in the Bible. Now, I follow more pass on the toss by force. Men, why you let the toss? That critical woman toss they have one push. Yes, why do you let it? I can just natural toss and more never. But I want for toss by force. You see it. So not to be there. Prevention is better than cure. So let's prevent low birth weight by making sure that you take the malaria dose. Now, I want to show you sugar. But I don't find it easy. I said, that's what I'm doing. So now it becomes a dot. DOT treatment. A dot. First, and not get the man who would do fear because who are one we are no younger. And take a would do fear. Now one. And so one of the things in pregnancy is aswade. Stubbornness. It's a character in pregnancy. They take the medicine. Just as the midwife put it in the book, so who do fear that one? They get home, they put the medicine in the bag, and they keep them unless the following months they are coming. We are not here. No, I can't hear free. It's a bit of a woman not anxious, but you say one. This is why he is when the real free with dashing. It's been a baby book, no donation. One. Now, if you are walking now, if you are in the money. Not like I stay. Now there's this, there's that, then they are running helter skelter. Malaria is a very stupid word. So please, do not let it get to you. When you are giving the SP, please take it. Are we okay? Now again, one thing that we also check out for is HIV. Now when they check for HIV, please, do not feel anything bad about it. Now it has become normal. The new normal later. It is no more a death sentence, but it only becomes a death sentence when you don't take your antiretroviral drugs. Any man by death sentence. It is no more a death sentence. Now let me tell you something again. Some people have been tested positive in their first pregnancy, took their ART medications. Now the more you take them, it suppresses the virus. So they become very difficult to be detected by first response again. And they will keep it to themselves. When they come for the next antenatal, because they don't come with the same antenatal book, they keep the report away from us. That is why some time back we developed a 3-in-1 antenatal book. So that your lab that you for the first pregnancy, they will see it when they get pregnant again. But we realized that it was becoming unnecessary. So they will make it individual. When they come for the next pregnancy and they are telling that they are negative, they wouldn't say, oh, I am a HIV patient. Then they keep mute, thinking that miraculously their HIV is gone because they are not receiving negative. And they keep the reports away from the midwife. You are negative. Fine. I will treat you as normal. I will not give you any special care because you are negative. Now, baby is born. You know, before an HIV mother will put the baby to breast, the baby has to be tested. And your mother has to be tested. The baby has to be given medication before my baby can start sucking mother's breast directly, because the breast milk is also a form of blood, but spice blood. But because you are negative, within the first 30 minutes of life, I must put baby to breast milk. So I put baby to breast milk. Then freely, you transmit the virus to the baby. Now so far, we have about 4 cases here that I am managing. Fortunately, they all came to me. The first one didn't know. In fact, she knew that she was. But when she was going for her second antenatal, she went to a different clinic. And when she was tested, she became negative. So she kept quiet. Then she went telling the person that now she's negative. So the partner also kept quiet. They both kept quiet. Pregnancy was successful. Current baby is out, breastfeeding. Then at 3 months, baby started falling sick, coughing here and there. Then we were changing the medication. Tell you, going from advancing antibiotics, changing medication here and there. I am giving you an example so that you take notice, you see how HIV is. Now, the baby got to 9 months. Then one time, after the baby comes for sin obesity, weight is also depreciating. So fortunately, they met a new doctor They saw a new doctor at my head office, my area hospital. Sorry. Then that doctor said, let's do an HIV test. Oh, why? Why should I do an HIV test? This small child, how can a child be HIV positive? Oh, it is just to clear out doubt. They did this and the baby was positive. Mother, let's do HIV test. The mother was positive. Then they want to check antenatal. You know, we do it 2 times. They did it, first one, it was negative. Second one, it was negative. How? Then the doctor came back probing. Madam, say, see, I'm HIV positive. But you show antenatal records, they check out that one you know. Then they get answer all Becca say. Me who me first born, not be HIV positive. Now me do me draw the boy. Now what is HIV a boy? The issue. It's a boy, you know. And I'm speaking a draw the fact. Oh, and one can't try me by this one. So there's something a man negative. It's the one you say Becca. Withholding information from the health person has resulted in the life of a 9-month-old child who would have had an HIV-free life and have given birth to a healthy child for you, the mother, but now has become HIV positive and must be on medication for life. So it is not good to hold information from your health personnel. You can hold information from your relatives, but when it comes to health, the reason why I couldn't let you see her book is confidentiality. When it comes to health, all health personnel are like the Roman father. And yet I'll be up for confession. I'm a Roman father said, "Ne auntie be car be ne ria a year on no ria." And no Sunday born a jam one or penasset. And the whole best record when you go for the body check. What do you go for Naka Bede? Make sure car a year, remember the work for police station. And I want confession because I'm confession that you. And I didn't find the body check. I will then look at. Then was it. God has forgiven you your sins. Go, your sins are forgiven. Go and sin no more. Now I'm not going to make your sins are forgiven. Go and sin no more. I can't. Who to be more police in Chino? Because police in background, you cannot say what somebody said in confession. Into your car. Do you get it? So as a health personnel, we are like Roman fathers. You tell me your case, it is sealed by me. And it's a relative someone can even if, so when it comes to HIV, we ask, who do you want us to tell? After test and everything is done, and you realize that you are positive, they ask, whom should we tell? Oh, catch them. Then when the man is invited, she's also told that you are the only person to know this. If anybody hears aside you and I, the 3 of us, then it is not me, it is you. Because I don't know where you stay. Even if I know where you stay, I don't know your friends. So what am I going to tell? Do you get it? So HIV status, you don't withhold it from us. Prolonged use of ART drugs may result you being negative. It doesn't mean you are cured. But you have reduced the virus to the nonsense degree that you cannot be slain or it cannot affect your ill health. But it doesn't mean you cannot transmit. You can transmit. Are we okay? So these are the reasons why we do this lab investigation. That is why when you are in your last trimester of pregnancy, that's what the midwife said, you don't leave the house without your book. Going to the church, what are the things they are supposed to carry? She mentioned them, so mention them. Yes, what are the things they are supposed to carry? Going to the church. In your last trimester, yes, first one. Delivering mats. Pad. Macintosh. A cloth. Partially used cloth. Partially used. And Sans said, no, I said, we are young girl from Cabanas, Hannah, Cabanas, and we are and that's what's an selected. Now they are partially used cloth, now they are. And then the last one here, then your passport to bed. But don't forget welcome. These things are supposed to come with you anytime you are coming for antenatal from 7 months. Because you might leave the house healthy, but once you are walking on the way to the antenatal, in the middle of the road, you start feeling severe lower abdominal pains. Now you get to the hospital and they realize it is labor. You see, hey, maybe 7 months into day. Also, so bad 7 months. What have to say? Oh, but there is no medicine that can tie. Because unless it's a medical body like BP and the labor. So when BP is stabilized, labor will go down. It's a different thing. And it's everyone now labor as a tea now. What time also you know? What put a delivery sheets? What put a tomorrow? What put a welcome? What put a part? You don't want to what we do when you are tired because I know I don't know you share that. Manu, we're about the critical. Like I said, the problem will be lawyers level. Or better watch the name now. When you talk about question, who will be your welcome at Tadia or my best shop? They are trying to manage 50 ever. So from 7 months, do not leave the house with this without these things.